SERENA-2 is a randomized Phase II study that included patients with ER-positive HER2-negative metastatic breast cancer that were post-menopausal and had received and progressed to prior endocrine therapy. Additional inclusion-exclusion criteria included having received at least one prior endocrine therapy or chemotherapy in the metastatic setting, and the presence of measurable or evaluable disease. 240 patients were included in the trial, were stratified according to the prior treatment with CDK4/6 inhibitors and the presence of lung or liver disease, and were randomized to receive 3 doses of Camizestrant, the novel oral selective ER degrader, 75 milligram, 150 milligram, and 300 milligram, or the standard of care Fulvestrant. The Camizestrant 300 milligram dose was discontinued early after 20 patients were included because of strategic reasons, not in the absence of toxicity concerns. So among these 240 patients, half of them had received prior CDK4/6 inhibitors, and 2/3 of them had lung or liver metastasis. 20% of them had received prior chemotherapy in the metastatic setting, and importantly, about 35 to 40% of the patients had a detectable ESR1 mutation at baseline. So the results of SERENA-2 showed that both doses of Camizestrant, 75 and 150 milligram, were superior to Fulvestrant in terms of PFS. The hazard ratio for the 75 comparison was 0.58, with a median PFS of 7.2 months in the Camizestrant 75 milligram arm, compared to 3.7 months in the Fulvestrant arm. And the hazard ratio for the 150 comparison was 0.67, with a median PFS of 7.7 months, compared to 3.7 months with Fulvestrant. These hazard ratios were statistically significant and also clinically meaningful. Importantly, in several subgroups of unmet clinical need, Camizestrant at both doses was also superior to Fulvestrant. These groups were patients with prior CDK4/6 inhibitors, patients with lung or liver metastases, those patients with the presence of ESR1 mutation at baseline, and also patients with evidence of ER-driven disease. Tolerability of Camizestrant was very good. Discontinuations due to adverse events were very infrequent, and so were dose reductions or dose interruptions. The most common adverse events associated with Camizestrant were photopsia, bradycardia, that was in almost all cases asymptomatic or grade 1, asthenia, anemia, and arthralgia. Again, all these adverse events were mostly grade 1, and the rate of grade 3 or higher adverse events was very rare. So in conclusion, SERENA-2 is the first trial that demonstrates the superiority of a range of doses of a next-generation oral SERD, Camizestrant, over the standard of care, Fulvestrant, in patients that are post-menopausal and have ER-positive HER2-negative breast cancer, and with a very tolerable profile. And these results support Camizestrant as a next-generation oral SERD to be used in future clinical trials.